Hi, all. For this week's assignment, this is the discussion on caffeine in regards to athletic performance while discussing the benefits, disadvantages, guidelines of caffeine usage, and certain recommendations. Now, caffeine is typically found for athletes in coffee or energy drinks, energy supplements, typically any of those. There are actually a lot of benefits on caffeine. A lot of it is used to enhance cognitive, muscular, and physiological performance when exercising or performing in sports. It has been shown that caffeine has a positive effect on muscular endurance, and what this means is that is an influx of calcium ions in the sarcoplasm, and the sarcoplasm helps with the muscular contractions. Because of this positive effect on muscular endurance, it improves the release of the calcium ions in order for muscular contraction to happen. And with the improvement on muscular endurance, it also improves with muscular power as well. Another a positive effect is that it inhibits negative effects on adenosine and also acts as a competitor to stop those inhibitors from happening, which is like the neural excitation or pain perception. And because of this, it helps improves focus and energy because it decreases the adenosine mediated fatigue that could happen without caffeine usage. It also acts as a glycogen saver, which means that it increases the mobilization of free fatty acids through the activation of adrenaline. As we know, caffeine affects energy and increases it, so it'll increase the adrenaline or fight or flight response when performing in your sport. It increases the activity of the sodium potassium pump. It shows significant improvement in central nervous system function in men. And it also increases circulating epinephrine, which is also helpful for the adrenaline increase. As for the disadvantages, there are quite a couple. The most common ones is that we know of is that it increases anxiety and heart rate. And when the heart rate and anxiety is increased, that means that there could be certain arrhythmias that could happen or other heart palpitation issues that could occur when using too much caffeine. In women, it affects hormonal performance, especially during the menstrual cycle, which could diminish performance and then enable in low energy. Also, it increases the rate of dehydration, especially if the athlete is not drinking enough water during performance time of the sport. And it causes excessive urination and gastrointestinal issues, which could result in maybe stomach ulcers and reduce sleep quality. Once the athlete consumes too much caffeine, that means they might not get enough sleep, and then the sleep is important for performance. Based on the NCAA guidelines, it is not technically a banned substance, even though it was considered a couple years ago. But it is acceptable at no greater than 50 micrograms per milliliter. And if the athlete ingests about 500 milligrams of caffeine, which could be up possibly 3 cold brews, about 2 to 3 hours before exercise, they can reach the limit of the 15 micrograms per milliliter. Obviously, it cannot be consumed in high doses. For the recommendations for athletes, the current guidelines are 3 milligrams per kilogram of body weight to 9 milligrams per kilogram of body weight. Obviously, that can affect everyone differently. So it is recommended to start off light, maybe at the 3 milligram rate if you're just starting to use caffeine. And keep in mind that caffeine applies the ergogenic aid at 3 milligrams to 6 milligrams per kilogram of body weight. So I think starting off with the ergogenic recommendations, that would be perfect enough for athletes. And it is recommended to consume it about an hour before exercise just to reduce any type of fatigue and increase the positive benefits effectively. Thank you.